chronic blackheads from solar damage.
Didn't it? All right. So we are live now on Mr. Pops It Live. And this is my first time using this software on the new channel. So let's see. I'm going to give it a minute as people show up. I'm sure we're not going to have as many as we do on the other channel, but people are going to be coming over. So hopefully comments. There we go. Shannon Gibson's here. Awesome. From South Carolina. Very cool. We're going to let some people show up here. I think we got people coming in now. Awesome. There we go. So, and this will be up on the live channel. There we go. Now we're getting some people coming over. I'm going to give them a second to go to the channel and find me. Awesome, Gene. Very cool. Laura from Georgia. Very cool. Shout some people out and say where you're from as people start to trickle in here. Leah Munsard. Hello, hello. Spread love minus hate. Hello. Beth Lukens from PA. Love it. Rita. I'm so glad you guys are able to find it here. So I think this is going to be definitely a better venue. Without restrictions, it's going to be better. So, and we're going to go through a couple videos today. South Africa, Sinette, Pretorius, very cool. Amy James. I'm letting people show up here just for a minute, so I'm just doing some shout outs. Very cool. People are finding it. That's awesome. So let's go. Sarah Bryan, Oklahoma. Karen Knight, Alabama. Spread love is from Winnipeg. Susie Q. Laura Barzik from Chicago. Thank you so much. The other day, you did a super chat, and I didn't get a chance to thank you because I didn't see it till afterwards. So, Laura Barzik, thank you so much. I couldn't see chat that day because I hadn't updated Chrome, and that's what happened. So, I appreciate it. Thank you. Rita from South Carolina. Trish Eaton. Hello, hello. Tam Nelson, New Zealand. Deborah. Everybody's finding it. I love it. So very cool in the beginning too. There's not going to be, there's no super chat on this yet, Laura. I have to build it up, but it takes time. That's okay. This one isn't monetized yet. What I need is, 1,000 subscribers, which we're almost there, which in just a week, which is awesome. We'll probably get there today or tomorrow, but you need 4,000 hours of views. So yeah, if all 1,000 people watched an hour, that'd be 4,000, but that's not how it works, unfortunately. So no super chat yet, but once it's monetized, then they allow super chat. And the cool thing about that is I'm going to have Space Monster Killer. Hello, hello. Thanks for coming over. The cool thing is there'll be able to be some ads on this channel. It'll be fully monetized. So that way, that helps all three channels move forward. So it takes a couple months. So that's no worries. I thought we'd have around 40 to 50. So we're about there now. Very cool. And I'm sure when people see the other live from Mr. Pops' channel, and they'll come over as we're going. So let's do it. First of all, let's talk a little bit about Favre Racouchot. Funny name, syndrome. It's also known as solar comedones, senile comedones, nodular elastosis. And solar elastosis is kind of the puffy thickening. It makes the wrinkles deeper. You commonly see it on people over 40 or 50 years of age that have worked outside for most of their life. So they, people who do construction, painters, roofers, it's Scotty. Very cool. So yeah, it's something that develops over time. Now they do say that possibly a hereditary component to it. And, because there has been some people in their 20s without a ton of sun exposure that have been in the literature to have been found to have this. But, all in all, it's mostly a severe sun damaged skin. And it's almost always, at least in the United States, because we drive, on the left side, because you're getting UVA through glass, even tinted, unless you have, there's some solar blocking tint you can get, ceramic tint, I believe they call it, or infrared. and it's clear coat. Even I have it on my windshield and on my side, basically on all my windows. And it is a UV blocking tint, and commonly it's a little bit more expensive. And you'll see when you go into a tint store, usually they'll have two heat lamps, and they'll have one that's like blacked out limo tint, and then one that looks like a clear piece of glass, and you put your hands behind them and you feel way less heat on the clear one, which you shouldn't normally, but that's that clear coat UV blocking tint for your cars. And if you drive a lot, even you drive every day, even a little bit, and over time that adds up. So yeah, it's good to have that. It's on your hands, you're going to get more freckles, and definitely on the left side in the United Kingdom, it's on the right side. 70%. I'm a redhead too, also, Suzanne, when I had hair. 70% of skin cancers are on the left side in the United States because of that. And it's the opposite in the United Kingdom because they drive on the right side. So, yes, cigarette smoking, when you look up this condition, it does seem to worsen it. And there's people that don't smoke that still get this, that have a lot of sun exposure, but smoking tends to make it worse. And out of the patients that I see, 9 out of 10 are smokers. And the video we're going to watch in a second, he was a smoker as well. So you have somebody that works outside, they're also a smoker. It's just a double whammy towards getting these. And the picture I have that I'm going to have on the thumbnail of this, which some of you saw on the community page, I was just watching, somebody was updating on the community page. Actually, a patient of mine from like 2014 or 15. And man, I wish I had my channel then. It's just packed in like 50 big blackheads. It would have been great. However, I did not have my channel then. I did not record extractions then. So that's unfortunate. But I would have loved to. But this patient came in. This is also the same patient I had that had the giant cheek abscess. It was a really big one. And you can see, I think in this video, this was on a follow-up. I did his cheek abscess first, and I realized he had Favre Racouchot, or the solar comedones. And hello, Jamie from Vermont. I was like, hey, once we get this abscess drained, I think he had a cyst there, and it's healed and it's kind of going down, we'll have you back in and I'll do some extractions for you. So I think you do see the follow-up on this video as well. So I'm going to try hard not to talk over myself, which I do. I'll either pause the video when I want to talk, and we'll get that going here. But this is kind of nice. It's like, under 100 people. It's a little bit more quaint. It's pretty cool. And as people start to come over, it'll get more like on the other channel. And I will still do some lives of big, like the bloody abscesses and big cysts. I'll be doing video dissections like this. I'm not going to do those most likely on this channel because I don't want to get it dinged once it is monetized and then they come in and take away all monetization again. So that's no bueno. I'm going to put myself in the corner here and feel like I look younger from 2 years ago.
Usually just sun damage, and there's a hereditary component to it as well. Generally along the zygomatic bone here, and multiple blackheads kind of clustered together and puffy, thicker skin there. So you can see we have multiple blackheads here, and we've got some whiteheads. So it's just going to be a couple small pokes, and we're going to do some extractions here for them today.
Some more whiteheads.
Pop right out.
Almost like milia as well.
Not too painful, right?
No.
Good.
Some of the big blackheads.
So you can see when you make that just little disruption on the skin, very, very little pressure, and these pop right out for them.
Yeah, good question, Susie. They say pimple popping, but I think it's more kind of bloody ones. So anything that has blood, and it anything with guns in it, anything with religion, they in 2017 really changed everything. So they started kind of restricting almost all those videos and taking away the ability to make money. So, it is what it is. Things change. That's what you got to do. But that's why I'm going to keep this mostly chats and more educational, talking about these. Some of these videos with just some blackheads here and there should be okay. But I will mark these as restricted. So if I mark it as restricted and they don't have to do it, I think it does not count against you. So when I do have a couple pimple popping ones on here, likely I will restrict that to 18 and over as I post it. So good question though. And another question, well, let's go a little bit and then I will talk about why I open the pore.
That way you don't get any bruising. Oh my God, like those.
There is some blurriness that comes up on this too, just because when you're that close in there and then my hands are in the way and then they're not in the way, it's trying to concentrate on different things. So it does go blurry here and there, but we'll get through that. But as far as, opening the pore, a lot of people are like, why do you have to go to a dermatologist to pop your own pimples? Or because you could pop your own pimples. And when people don't make a little opening, and if you do it incorrectly, you can scar somebody or yourself. And if you're just sitting there pushing and that opening, there isn't an exit for it, that's when you can kind of blow out on the bottom, and that's what can cause pitted scars. So when people are really squeezing, or if it's not the correct one, if you're not, you're trying to pop one that has more induration, like especially the hormonal acne nodules that a lot of women get. There's not a whole lot of pus in a lot of those. It's mostly induration and swelling, and when you squeeze on that hyper agitated area just releases more inflammatory markers and becomes more inflamed and can dissolve or eat away some collagen that can cause indented scars. So when people talk about, we do this every day, or a lot of days, knowing which ones are ripe and able to be popped, knowing which tool to use, 18 gauge, 25 gauge, or sometimes an 11 blade, is like trying to pop a balloon. Exactly. If you're just like, but if you open up, untie it a little bit, you can squeeze the air out. It doesn't get so much. It's a good analogy, Suzanne. So making that little opening in the skin, when you use an 11 blade, it's a triangular, very sharp, very thin blade. You actually can make a decent cut, and it heals right back together, and people don't even see a scar. You go too deep and too wide, you could, but when you do it correctly, a lot of people are like, oh, you're scarring their face. You're not. It actually heals right back together and does a great job. For bigger ones like this, I'll use an 18 gauge, which is kind of a mini wedge. Just opens it a little bit bigger than a 25 gauge needle. But I go around and kind of make these little cuts. You will see one coming up here that's a sebaceous hyperplasia and looks like a big whitehead, but it's actually kind of just white kind of fluid that comes out, and it's just sebum, and because it's an enlarged oil gland. Here we go.
And the benefit of doing this is that he's prone to getting cysts. So some of these are little follicular cysts. By removing these, we're lowering his risk of getting another big abscess like he had on the other side that we drained. This bigger one right there.
That's a good example. You can see it's oxidized at the top. People talk about that all the time. You guys have probably heard it before, but when that sebum and oil mix together to make that keratin kind of white, creamy paste, where it's exposed to oxygen, oxidizes, and you see it kind of hardens up and gets dark. So yes, Wendy, welcome for sure. Mr. Pops It Live. People are coming over slowly but surely. It'll take some time to build, but it's going to be fun once it's up and running. It'll be great to have a procedure channel and then a live chat channel. I just think it's good to separate those because there's no reason that this live chat should be restricted. It's ridiculous. So here we go.
good. Come across those other ones. There we go. It's a good size one there.
Creamy pop.
Little hair follicle in that one too. Got that out.
So we're coming up to that sebaceous hyperplasia. It's the next one. Right there. Yes. Not much coming out at all.
That one, he has a sebaceous hyperplasia. Right,
they can
there.
look
There's
identical.
Enlarged oil gland. It'll look kind of white, but just clear fluid comes out. And that one's actually not a pocket of keratin. Also get those from sun damage and hereditary as well.
Thanks, Chris.
Get a little finger squeeze on that last one. Perfect. You can see some of those hairs coming out right here. Very good. So now when we pull the skin, you can see he's got a couple of those sebaceous hyperplasias, but all of those clogged pores
On the left cheek.
are clearing out. All the blackheads. That's looking great. You can still see some of the thickness of the skin there, and that's that kind of solar elastosis or thickening of the skin from sun damage. It just kind of gets puffy and it fills up there, these little cysts, but he's looking great. We'll do a couple little finger squeezes on the edge here and get some of these out. And right below there, just a little collection of blackheads there. That's good. You can see some of the hairs coming out of those too. So that's looking good. That whole area here is where he had most of his blackheads and clogged pores. We got all this out. It will refill in time, but it'll take a while, and that will slow down any cyst formation usually too. So that should be good. Just looking for any others. That looks okay. Let's check the other side.
One thing a lot of people ask on the extractions is, do you get it all the way clear? And, you know, do you go back? I do go back. And I go back and sometimes with my loop extractor as well and finger squeezes, you know, there's so many questions about why you use what you use. And, you know, to extract certain areas. Certain areas, there are some areas that are better with a loop extractor, in particular on the forehead or where you have a bony prominence behind it. One thing I don't like about the loop extractor is it's a loop and it's kind of like a U, and the side where, you know, it's not a full circle. You kind of have to pull from different angles and kind of come from the left and come from the right sometimes to get the whole pore cleared. And the thing I like about Q-tips or you know, cotton-tipped applicators with the wood, and I only use the ones with the wood hand, like, stick on them, is that they are a little bit more gentle on the skin. There's certain areas you can utilize them in a lot of areas. I don't like it on the nose because it's so mushy, but you can kind of come around and go up, left, right. There, it's easier to kind of maneuver around. So they seem to be less painful for most people. And so a lot of people say, oh, you didn't clear that pore. Sometimes it didn't get all the way clear. I do go back through, not on camera, but the ones that do still have it in usually make the cut. So, I mean, I go back through, but I edit it out. But the ones that do still have stuff in there, I do, you know, show that most of the time. Like, hey, I came back, there's a little bit left at the bottom. Or I'll try, you know, a different tool or just a good finger squeeze. The finger pads, you can really get under it sometimes with a finger pad squeeze too. So that's a common question, and there's no right or wrong answer. There's a lot of different ways to extract these out. The bigger thing is having the experience to know what should or can be extracted and what shouldn't be extracted. Sometimes I'll feel, I'll come in and feel something that's really just started, just kind of new, and it hasn't built up a lot of purulence in there yet. And I will, it's not ripe enough yet. We won't go for that then. Sometimes I'll just do a small Kenalog injection into those because it's more induration and inflammation, and putting an anti-inflammatory in there will actually bring it down before it gets filled with a lot of pus. Sometimes they come back again in 3 to 7 days, and then we'll do, another cycle of extractions. There's a lot of different ways to do it, but the whole reason is to minimize scarring. And so when we do that, trying to minimize scarring is the reason I do all of this, and getting these pores kind of cleared out. Like I think that Scotty said, some people say to keep the filament in there. If you're extracting them correctly and then you're putting them on a retinoid or something topically, glycolics or salicylic acids, to stop or slow down the pore from refilling, that pore has a sebaceous gland at the bottom of it that's producing sebum and oil, which is kind of clearing out. It comes up onto the skin to keep the skin hydrated. And when it's clogged, it's not getting out there a lot of times to get onto the skin and hydrate the skin. And so you'll get people with dry skin, and wrinkles will form easier. When people always say, I don't like my oily skin. It's actually been shown, proven with over time, people that are more oily have less wrinkles in time. So, and people that are drier, that's why smokers, they're producing less sebum and oil, and they tend to have more wrinkles because of that. So there's a direct correlation. TT, welcome. I know I left that live up on Mr. Pops so people can go, oh, there's a live right now, and they go and click that, and then they see, oh, he's over here, and some people are coming over. Very cool. So, and the other thing to remember, and good point, Kelbell, when people are in the teenage years, your hormones are all over the place. So you're going to have a lot of growth and development during that time, and you have growth plates on your bones, and that's what's signaling to your body, hey, we need higher levels of hormone. Those growth plates are the signal, and those growth plates get smaller and smaller and smaller, and then they're done growing, commonly 17 to 19 for women and 18 to 22 for men. When that is done, that is the signal for the hormones to level out, and then commonly the oil production levels out, and the exfoliation, you're producing a lot more skin cells at that time. Your hair is growing at the fastest rate ever because of those hormone fluctuations that are supposed to be there and supposed to happen. So when that kind of levels out, now adult acne happens. It's just not as common as adolescent acne, and there's a lot of different reasons for adult acne. Oh yeah, filament. I was using what Scotty had said. Really, it depends on the pore. If there is a hair shaft coming out of that particular pore, sometimes there's vellus hairs that are real small hairs. Sometimes there'll be a little keratin plug on the hair or around. I think that's what he was referring to as filament. It's like a keratin plug, basically. And keratin is sebum and dead skin and oils mixing together. And they can be as dense as candle wax sometimes when they're drying out. So it's just that little kind of plug that comes out. So let's keep going to the other side. You can see, I just want to take a moment there to address that pores cleared or not cleared. Yes, melanoma, I will be, Wendy. I'm sorry that you went through that too. And there are certain care instructions afterwards. That's going to be a whole different live. But it's, I have some good cases right now. I know the patient that we had shared, I want to do a follow-up update on him as well. So, but yeah, I digress. I could keep going squirrel. I'll go squirrel left and right all day long. But yeah, remind me. I think that's a good one. I think it's a good one that should be addressed, and I think it saves lives too. So it's a good one to talk about. So let me hit play again. Let's see what we got on the other cheek. Not as many, but you can see his scar. He was supposed to come back in. You'll see this scar. For me to cut out that scar, and he had a little cyst, I think, underneath, but he didn't come back. So sometimes, you know, these older guys, they just want, well, hey, I need to address this right now. Once it's done, they don't care. They really don't care. It's very common. He'll probably come in 2 years from now and be like, hey, healed great, but we could have done that for you. Here we go.
Here we go. Quite a large pocket there. Got it. We're going to do a little bit out of that mole coming right out the top. Very good.
Yeah, sorry.
Came right out the pore with that mole. Okay. One blackhead here on the nose. This will be quick. Right there.
I think this video is almost done.
Pop that right out, just the blade. Perfect. Little needle got that. All right, guys, that was it. Just want to thank my patient for sharing his abscess and those clogged pores.
Here we go.
That was a...
Okay, so what I'm going to do here, let's bring up... There we go. It worked. I can't believe it. Yeah, so let's address...
Okay, guys, we can see here, this is our patient we've been working on. We did the lips last time.
So this is the one, he's got a lot on the nose and he has some around the lips. I think he even had some in the ears too. So we're going to go through a little bit of this, but before I do that, yeah, we kind of talked about, I think on my last live, I was answering some common questions, and I think I talked about adult acne absolutely happens. And female hormonal acne is one of the most frustrating things, and for women that go through it. And it's something we deal with a lot, and there's a lot of different ways to come at it. And one thing you really want to check with your primary care doctor is to make sure you don't have abnormal hormones levels, because like PCOS, polycystic ovarian syndrome, it can just really be like in the red. You know, you're with outside the normal limits. And, you know, there's some more drastic things you can do for that. However, it's something that can be frustrating, but it's usually caught because they're doing blood work. What else happens is when people get a small cyst on their ovary, that isn't uncommon. Not polycystic ovarian syndrome and tons of cysts, but women will form. It actually means you're fertile. You'll have a couple active follicles and you're only dropping one egg, but you may have a couple, and sometimes they even see them on an ultrasound, a couple, one or two small inflamed follicles, an egg that was getting ready, that it's got inflamed, and it might be there for a couple months. And when it is, it's going to cause some fluctuations. And those fluctuations still may be within normal limits, though, so it doesn't always get tagged. But if you looked and went back in a year and looked at a couple blood draws, you may see, oh, wow, this is towards the high end, and before it was middle to low. And sometimes those little fluctuations do cause some pretty severe hormonal acne for women. And getting on something like spironolactone, binding, you can't stop those hormones, obviously, but we can bind to them and inactivate them. So that's something that can be done that is helpful. And you know, in doing so, you'll change lives. You know, some of these things turn into scars, and if not permanent scars, at least pigment for 6 to 12 months. And women really don't like that pigment. And sometimes they'll start getting melasma as well. You start getting, you know, brown pigment, big brown splotchy areas on the cheeks because of hormone fluctuations and melanin release mixed with sun exposure. So that's another thing that comes along with it that can be very, very frustrating for them. So yeah, just wanted to bring that up because that is something I address daily. But let's see, we'll see some no's right here. I gotta go close the door because the kids just got back with Mrs. Bobsit. Let's hit play
Looking
here.
a lot better. He had some big ones through there, and his nose had a lot of huge blackheads before. And you can see he's got a couple inflammatory ones starting up here and a couple restarting up here, but man, I would say 75% improvement after just 2 sessions, and he had quite a bit. So this is what we do. We kind of come through here and clear some of these out. He's got a little bit in this area and on the nose, but we'll get these, and now he's on a good retinoid. That should help. So we'll get him cleared today. This way. We got a little inflammatory one here. A little pressure, sorry. You okay?
Yep.
Good.
See, I'll kind of pulse
Just a little core in there.
instead of one big deep squeeze, just to kind of get some of that more fluid, like on the surface, and then there's usually a core in there too. Oh, man.
Those are a little tender, but that looks good. Got that core. Let's see if we can roll these out. Yeah, there we go.
Another thing, I don't always have the same camera person. So I'm in different offices. I have different medical assistants sometimes. So, you know, I know there's a lot of comments about the camera person. They do their best. And I know it's hard because I'm constantly moving all the time. And they don't want to like jerk the camera around. So they try to slowly move it. I usually edit out most of the bad stuff. But yeah, it's tough. What's my favorite place to pop? There's no favorite. I love them all. It's fun. I've liked it since I was a kid. So I definitely got into the right business for sure. Here, let's push play, though, here and see some more. You do see, that's about as far as I go right there, because there's still kind of a little plate of cartilage right here in bone where it's still pretty firm. So that's about as far as I go with the cotton tip applicators. And then I go to the tip of the nose, more spongy, or on the sides here in the corner. Sometimes I'll do a loop extractor in here. But I commonly don't use the Q-tips because you just can't. It just is mush. It's too much mush. So I'll go in with the hands and do a finger squeeze. Here we go.
Finger squeeze for him here. Just in the crease there.
Getting some stringers out there.
Nice. Got it. Looking good. A little bit coming up here. The tip of the nose. These all have little tiny hairs in them. And over here.
Yeah, he's got these little vellus hairs that were coming out of these.
Good. Some blackheads right there. Here they come. Very nice. Nice clearance there.
It's funny, as I go back on some of these older videos, I really see my editing has gotten better and transitioning from scene to scene. Those are things they don't teach you in PA school, that's for sure. So it's kind of fun to see that, because I see, oh, I would have done that different. But you know, hey, that's everything is just a big learning curve going on YouTube. So for sure. Let me hit play here.
Big one right on there. You can hear it pop.
That is actually the sound that happened. I forgot about this. This is pretty funny. Let me go back so you can hear it in real time. Now, let's go back to it.
Some blackheads right there. Here they come. Very nice. Nice clearance
There's a little
there.
pop that happens.
Big one right on there. You can hear it pop.
Little tiny. This actually happens quite a bit. Fingernails.
There it is.
There we go. Very short.
That was a big one there. Doing okay?
Good.
Good. Let's go back over here. A little finger squeeze at the bottom of these ones.
Oh, let me get myself out of the way. Sorry, guys. Boom. Good question, Scotty.
Got him. Okay.
I want to address that. I have business cards, and I have given them to people. In particular, it was somebody at the checkout counter, and you don't want to embarrass them. And I usually it's just when it's me and them only. If there's like people around, I won't do it, or I'll see like this particular time I was the only one in line, and I was like, hey, here's my card. Just call. I know you have some pretty bad inflammatory acne. That's what I do for a living. If you're interested, I think I could really help you. And it's not far from here. And call the number on there and come by. And they did. And we got them better. This was before I had a YouTube channel, the last one I did. So it's been 2 years or so. But it's a time and a place that you do that, because some people are like, oh, you think I don't take care of myself? Or I have had a guy that had a melanoma on his back in a jacuzzi once. And this was years ago. I think it was in Hawaii. And I was on vacation. This guy's splotchy thing on his back. And I was like, hey, I don't mean to be too forward or anything, but I work in skin. I am a dermatology physician assistant. And, I just would tell you, sometimes people don't see stuff on their back. I would recommend that you get that black spot taken care of. And he's like, yeah, I have a dermatologist. Thank you. Like, he was not very happy. And it's funny. I thought later to myself, I was like, if somebody said that to me, I wouldn't be offended. Maybe he's just having a bad day. But, I guess it's just different people in the world. I don't get offended easily. So maybe he does. Who knows? But that's a funny story. And, you don't want to, I guess the offense that would be taken is the assumption that he's not getting checked or something like that. So I guess that's what you're assuming when you say that. But anyways, it's a time and a place. Pick your battles is what I say. But with something like melanoma, if I saw it, I would say it every time. That hasn't happened often, but I'm not going to be like shy. If I think something's a melanoma, I could potentially save somebody's life, even if they get mad. I would say, hey, that looks like melanoma. Make sure your provider checks that. It should come off. Obviously, I'm seeing it from a distance. I'm not up close, but I would say something like, that's atypical enough looking. Just make sure somebody looks at it. And maybe it's just a black seborrheic keratosis, which is common. But if I don't get too close to it, it'll be hard to see from 4 to 6 feet away. But yeah, so let's go back. Let's see some pops here.
He had some really big ones we did last time. About 3 of them have refilled, so we're going to get those. 1.
That's a 25 gauge needle there. I'm looking for a small opening.
Sorry, that's really tender. I
Just
know.
opening the pore there.
Okay. Let's see if we can get these clear for him. A little pinch.
There we go.
Got it. Such a tender area.
Sure, Anne-Marie. I think they could help you.
Right here by the nose is not fun. A little pressure. I'm going to go slow, okay?
Ooh, that looks so painful.
Good.
He was tough, though.
Hopefully not too bad. One more. Just checking the pore here. Got it.
Wow.
Very focused. You okay?
Yeah.
Good. That's not.
He's a young guy. He's very tough. His eyes will water a little bit, but he doesn't move. He doesn't jump. We've done a lot of extractions on him. He's just so happy to get it clear. There was a question I wanted to answer. Let's see. Oh, prep the skin before. Yeah. So sometimes if I do have time, I will tell them, to do a warm water wash. We're at 76 people. This is great. This is just a brand new channel, just from a week old. So very cool. You guys are coming over. I appreciate it. Sometimes like a warm compress or a warm cloth, warm towels. I don't always have time for that though. And not every office has a warmer. So but as far as chlorhexidine or Hibiclins, I will do a foam kind of light wash because we are going in with needles sometimes and I don't want to bring bacteria into the skin. So chlorhexidine is a good, it kills a lot of bacteria there. So that's a prep that I do. And then we'll kind of wipe that down. In certain areas, sometimes we'll even do alcohol if it's like a bigger one on top of that. But my main thing is to kill bacteria. As far as pores being open or not open, I can get them open. So I don't have to use like a bunch of chemicals or warmth with the different 25 gauge or a 18 gauge. I'm getting the opening that I need. So now where that does play a bigger part is when you're not opening the pores. And some estheticians do not or cannot, because of state law, pierce the skin. So they'll use a lot of warmth, steamers, all kinds of stuff, and there's nothing wrong with that. They're trying to loosen the plugs. So that's a common, thing. It's a little bit different from what we're doing. I'm going in and physically manipulating quite a bit. Sometimes estheticians can't do that in certain states, and California is one of those states. So I know there's a lot of estheticians on here, and I think that's great that they do that. They're using what they can to loosen that and get that open, and there's nothing wrong with that. I think it's helpful and beneficial. That's a good question. That's something that's come up multiple times too that I've never really addressed. Here we go. Let's get back on it.
Fun. That looks great. Got all those bumps out. Okay, looking good. A couple just on the side here. There.
Can see all those little plugs.
Just coming right through there. Pressure. Coming up here. Got it. And quite a few in the crease there. Good. Can try to do a finger squeeze there. It's not fun. That's good. We're getting it. Still coming.
That's a lot coming out. God, it went a little bit.
You hanging in there? I know that's not fun, man. We're in some sensitive areas here, but you're doing great. He's tough. That looks great. Nice and clear all the way around to the nose there. Yeah, make sure your eyes water. You can go ahead and dab real quick. That's good. You okay?
Yeah.
Good. It's not fun, but we cleared out the whole area there. That looks good. Let me see on this side here. We're going to do a little bit over here.
I'm not talk over myself. He had a lot of milia as well, which are kind of like more of a little encapsulated follicular cyst. They have like a little ball. But we're up to almost 80 people, man. This is great. Glad you guys are finding it.
Very nice. Got him. Good. See those, some of them have little hairs and they pop right out, and you can pull that and those bumps are gone. There's a little residual right there. And it's hard to film with my fingers in the way, huh? Mm-hmm. A little bit at the top here. Perfect. I like that. Crease here just a little. Okay. Now we're going to come right here and just come right up the forehead. His ears are nice and clear. I don't see anything in the ears.
I know, Mel, there's nothing worse than being a popper and seeing the perfect pop and that people just don't want it done. I've had patients that were really, really good, candidates for an extraction session, and it would have helped them a lot, and they just didn't want it, just didn't care. Usually they're older guys. Most women tend to be like, yeah, that could help me, I'm in for it, but some older guys just, they have certain priorities in their life, and that's it. That's all that matters to them. So, and a lot of times there'll be guys that maybe work construction or did work outside. They have solar elastosis and the thickening of the skin and big blackheads. And I have found that when I'm just doing skin checks, I'll be going along and I'll be like, hey, a little pressure here. And I'll just pop them out as I go if it's just a one-off. But when they have a lot of them, it's just funny. It's another oxidized plug. You can see that dark spot at the top.
Carmen, I'll set one in here and then push against that one, just like that. There we go. Almost got a little bit out of that one. Got him. Big black head right here.
Hiding in the eyebrow.
You can see those hairs in both of those. Very good.
Okay.
Long stringers there. Good.
So a good question about dark spots, Tracy. So depends on what the dark spot is. And this is a common thing. Sometimes you look close, there'll actually be a seborrheic keratosis starting, and they're a little thicker. They're not quite like wart-like yet, but you will see like this kind of circle. And if you look close, you almost see like crisscross lines on it. And I was looking outside. Something was moving outside. Seborrheic keratosis, a lot of times you need to do more of a destruction. And solar lentigos or lentigo simplex is more of, or melasma is more of melanin release from the melanocytes. And that will cause kind of a flat brown pigment. And that you can do hydroquinone bleaching creams. There's lots of different strengths of hydroquinone. In the state of California, they let derm offices do 6 or 7%. We have it made for us, and over the counter is usually 1 or 2%, and a prescription sometimes go usually 4% unless you get Triluma, which is one that was canceled for a while, and then it's come back, I think, recently. So, yeah. So that bleaching creams, they're Cosmolon. There's certain peels that are really invasive. You got to make sure you see a professional and make sure your skin tone is right for it, and you don't hyperpigment yourself by doing it. But yeah, different types of peels, different types of bleaching creams. There's even some oral pills that sometimes people take, tranexamic acid. Almost like vitamins that they say in some clinical trials tend to lighten it. I've had okay results with that, but let's keep going. We're almost done here. I'm going to leave a couple minutes at the end to answer some more questions too. So.
Got it. Here.
It's interesting. He kind of has a forehead where you don't see a lot unless you look really close. Some people, you just see all these bumps and it's raised up and really filled. He has actually quite a bit in his pores. And from 4 feet away, you don't see a whole lot there until you get up really close. And that's why I pull the skin a lot. Sometimes pulling that skin, you can see the bumps when you pull the skin. If some people, especially younger, they have thicker skin. But he also has a lot. He's pretty oily. He has a lot of oil production. And that's why.
There, he's got a couple big blackheads right in the hairline here. Very good. Broken stick. Stick down. There we go. There we go. Take 2. Got it. You can see all these plugs through here.
You can kind of see little bumps there where we've been squeezing. Nice.
Okay. See all those little curly cues coming out. Oh, I think that one was already emptied, so it looks good. Sometimes you can pull the skin and you'll see these little plugs better.
Sue, you're having trouble accessing the live channel. It is a new channel, so sometimes I don't know. It's been an issue where it doesn't come up all the time. So I'll have like friends try to look it up and they can't. But it's been long enough now. You should be able to get on there. You just hit subscribe, and you should get notifications when I go live. If you hit the notification bell. So yeah, subscribe to it and hit. You might not be hitting the bell. Maybe that's it. But yeah, and I've only had 2 videos here, so. This is the second video, so it's just getting started this week, so maybe that's why. But on my other channel, a lot of notifications weren't going out, and I kept getting that comment. And that's why I started this channel, so we can have a better dialogue. And you should, if this channel doesn't get demonetized and dinged, which it shouldn't, on ones like this where I am going to show some videos, I am going to self-restrict that, 18 and over. And as long as I'm doing that correctly, I don't think you get dinged for that. So yeah. Okay. That was it. You didn't hit the bell. Good.
These are pretty small.
Almost done here.
Worth doing.
Just showing some.
Okay, so Milia, he's got a lot of teeny tiny ones here. They gotta be a certain size to get them out. They just don't pop out well when they're really small.
And that's a good point. Really small milia, when milia are tricky. A lot of people try to squeeze milia and they really irritate their skin. I'm glad I got to that point, because that's one of the last things I want to talk about. Milia that are just 0.5 millimeter, real small ones, they have that little sheath of skin over them, and I take something really sharp and just make a little tiny scrape on that surface, and they pop right out. When they're super small, I go in and you try to push on it, even with something sharp, it like pushes down, and you can't, there's nothing, they're just so small, it's hard. And you do like a little cut there. And when you do a little cut like that, it usually pops out if it's 1 millimeter or bigger. So it just needs to be a little bit bigger. And they pop out very easily. If you don't make that cut on the skin, it is not easy. They won't come out. I'm trying to make myself bigger here. So they will not come out. They're just sitting there, and they squeeze. And I see people come in with bruising, and then sometimes they turn into even a small abscess because they've irritated it so much. So with milia, I usually tell people to see a professional. I see them on the eyelids all the time, like right up by the lid margin. And I think that's Mrs. Pops that giving me the yank sign. Yank me up. So we're going to go to lunch with Pop Pop. If you guys know Pop Pop, when we go to his house sometimes, we're going to be going to lunch with him. But yes, so with milia, I have a really cool video, milia extractions on the upper lids. And I have a technique. I haven't really seen many people do it. I'm sure somebody else has done it. But where I will take forceps that don't have teeth on them, and I will just get and kind of pinch up, get under the milia and do a light pinch like this. And it just brings it right up. And then I can really have it and make that little cut, and then it rolls right out with the forceps. You just have to be really good at squeezing light. If you're not real good with your fingers, I don't recommend that, because you can easily hurt somebody. But yeah, that's why they come to me to do that. And he had been to places and people had told him, no, they're on the eyelid. They can't be done. Even at a derm office, somebody told him that. So yeah, I mean, you do have to really take your time. But it's a good video, and it's on there. So it's just way back probably. But yeah, she knows I could talk for hours. Boy, isn't that the truth? Funny story about that. When I first met her, I'd known her for a while, but the first time like we went out as a group, we met in a restaurant and a bunch of people went out. And kind of the first time we were in the same group talking, everybody else left. And we talked in the parking lot until the sun came up on a Friday night. And then we went home to our apartments and we slept. And then the next day we did it again. And we talked all night. Hi, little cutie. Oh my goodness. Mommy didn't. Your nose is a little bad here. Let's wipe it. Can you say hi right now? Look at that. Look, do you see yourself?
Hi.
Say hi, baby girl.
Daddy, that's a new one. That's a big one.
Yeah, that's right. That's the phones. Is it time to go to lunch?
Uh-huh.
It sure is. Can you wave? Look at all that. Did you get into mommy's bangles? Look at that. That's no joke right there. Is that fun?
Yes.
Yes, it is.
Mine.
All right. Can you say bye-bye and blow a kiss?
Goodbye.
Goodbye. All right. Go back to mommy. We're going to wrap it up. We're going to wrap it up. That is definitely the it's over sign. So we've almost went an hour, though. That was great. She's so fun. Thank you so much. She is a blast, actually, and very different from my boys. It's pretty crazy. So yeah, fun. This was a good video, guys. We talked about extractions. We talked about Milia. Hey, babe, you want to grab her or no? I'm just trying to finish up. Hey, there's Mrs. Popsit. She should say hi too. No, she's not going to. I think she's getting ready. So, yes. Gosh, I'm squirreling all over the place here. Squirrel. Thank you guys so much for coming by and finding the live and taking the time to subscribe and find this. So that is awesome. I really appreciate it. I think it's going to be good. It's just building. I mean, we had 50 to 100 people this whole time, and that's only the second time we've done it. And I'm assuming we'll probably be over 1,000. I haven't checked. I'm not sure where we're at, but we were close to 900 when we started this thing. So we'll keep it going. I'm gonna try to at least do one live a week on either Friday or Sunday, and some of them, like this weekend, there'll be two. So I'll do maybe a Friday and a Sunday. So, and sometimes it'll just be to answer questions, common questions. Sometimes it will be a dermatology diagnosis breakdown, and sometimes it'll be a video dissection like this. And a way to communicate. I will pop on Mr. Popsit. I know some people don't like that because they feel like I'm teasing them because I go on and then I leave, but it's the only way to let people know. Because I know different days some people are available to even watch a live. So I kind of do them at different days through the week. But yeah, so this should be good. We got to call it a day here. But thanks again for popping by, guys. And that was a fun talk. We'll do it again. Have a great day and a good rest of your weekend, I should say. Bye.